Thanks, Tim. So I'm Karen. I'm a research officer at POCOG, which is the Psycho-Oncology Cooperative Research Group at the University of Sydney. And I'm going to talk about a study that I've been involved with, which is the development and evaluation of patient resources to explain screening for anxiety and depression in cancer care. So this is part of a large program of work, a 5-year program called the ADAPT program. And the aim of that large program is to facilitate the integration of the clinical pathway for anxiety and depression in cancer patients into routine care. We're in phase 1 of the project at the moment, which is pilot testing of some of the resources that will become part of the broader program. And the pilot testing I'm focusing on today is development of some patient resources which explain online screening and excuse me, recommended links to local and national support. So the aim of the patient resources pilot was to develop and evaluate some information specifically for patients that explains the importance and practicalities of routine screening for anxiety and depression. We got together an expert working group who reviewed the existing resources available and developed some new resources. So 2 resources were developed. One was an A5 pamphlet which provided a very brief overview of screening. And the other was some website content, which is a bit more comprehensive and talked about what are anxiety and depression, what to expect in screening for anxiety and depression, and referral to psychosocial services. We evaluated these resources in 2 ways. The first one was through an expert consumer review, and then through qualitative and questionnaire feedback from 21 cancer survivors. So with our 21 cancer survivors, we ran 3 focus groups and 10 interviews. The participants were mostly female, aged between 59 and 64, were cancer survivors with a diagnosis between 1 and 5 years prior, were highly educated and had a range of cancer types. So the results. So in the questionnaire feedback for the A5 pamphlet, generally participants were very positive. They said there was about the right amount of information. It wasn't at all upsetting. It was about the right length. Most things were clear and it was very helpful. In the more comprehensive website content document, participants were generally quite positive, but it was a little bit more varied. A lot of participants, or some participants, told us that there was a bit too much information and it was a bit long. And we think this is because the format that they were reviewing it in was a printed Word document rather than seeing it on screen as it would be for a website. And we think that when it's up on the website and you'll be able to click through menus, that will be a bit easier and won't feel like so much information. Some participants also told us that the content was a bit upsetting, and that was mostly because it reminded them back to their time of diagnosis and their experiences with anxiety and depression. But importantly, those people that told us that it was upsetting, they were very supportive of the program overall. We also heard that most things were clear and the information was helpful in the website content. So from the qualitative feedback that we received through interviews and focus groups, generally participants were very supportive of routine screening. They thought it was a good idea, especially at the beginning following their cancer diagnosis, and they didn't see it a problem at all. It was just another part of their cancer treatment. However, they did vary in their preferred timing of screening. So some participants told us that they'd prefer it right at the start of their cancer treatment, and they needed that psychological support, particularly in talking to family about their diagnosis. Other participants said that right at the start of cancer treatment wasn't the right time to do screening for anxiety and depression, and they were really focused on their physical health at that time, and they would have preferred screening to start 1 to 2 months later. Participants were all supportive of ongoing screening. They thought it was a good way to keep track of how they were going and for their cancer care team to keep track of how they were going. And it was just another thing that they did as part of their cancer treatment, and they were very accepting of that. Participants also varied in the health professionals they thought should be conducting the screening, and they were generally the cancer specialist, the nurse, or the GP were the three responses we got mostly. And participants really varied in their experience of psychosocial support that they were offered throughout their cancer treatment. So some participants were part of a screening program, others were offered support from counsellors and psychologists, and some took it up. And others tried to seek out psychosocial services and weren't able to find it. Like that one participant said, she felt like she was lost in the system. Okay, so the next steps for the patient resources is to review the resources based on the feedback that we've received, particularly around some comments that some of the information was upsetting. We're going to collect some further feedback during pilot testing later this year and have everything ready to go for the larger ADAPT program in 2017. Lastly, I just want to thank the Cancer Institute for funding this program of work, and of course thank the patients and their carers for their contribution to the study.